Well, it says I'm live, but I don't think I am. There it goes. Okay. So, hey guys on YouTube. Hey, people are popping up. I am live. Yes. All right. And I'm going to go live over here on Facebook too. So, as you guys are jumping on, if you have questions, feel free to put them in the chat. Hello over on Facebook. We're live finally. It's a Tuesday, not a Friday. It's been kind of a crazy month, so hope everybody's been doing well. Here to answer your questions on Facebook and also on YouTube. So, as you guys are jumping on, let me know if you can hear it and see it. I want to be sure that the audio and the video are both working properly. So let me know there on YouTube if you can hear me. And ditto over here on Facebook. Anybody's jumping on? I can't tell. All right. Looks like some people are jumping on Facebook. Hey, guys. If you can hear me and see me, let me know that this thing is working. And if you have questions, put them in the chat and I'll be happy to answer them. I'm just refreshing my feeds here to see if I can see your comments as we're going. Click for more. I did click for more. Okay. All right. So hey, if you're on Facebook and you can hear me, see me, let me know. Just put something in the chat so I'll know this thing's working. I got a little bit of different setup today. Let's see. Over here on YouTube, I can hear and see fine. Awesome. Great. Thanks, guys. Let's see. Amanda has a question. Can a HSG test help you conceive? Yeah, actually, it turns out that it can. Hey, Kyla, how's it going? So hysterosalpingogram, for those of you that don't know, is an X-ray, and that is one of the things we do to test for people who are having problems with fertility. And interestingly enough, there is some evidence that you do see an increased rate of pregnancies occurring after that HSG test. So something about blowing that dye through the tubes is apparently a good thing. So good, cool, thanks. And thanks, guys. Tiffany, thanks. It's working on Facebook. Awesome. So if you have questions, put them in the chat there. To me, it looks like it's just frozen. I don't know if the video is flowing over there. Hopefully it is. Looks like it is. Okay, cool. I think everything's working. So people are jumping on. Welcome, everybody. Live, Facebook, live, YouTube. Here to answer your questions. Don't see any questions popping up yet. So I will tell you about a video that I'm working on that is going to be of interest to a lot of people. So there's a new treatment for postpartum depression. Just got approved by the FDA. Brexanolone, I think is a generic name. It's an injection, and it's different than any other antidepressant on the market. It was specifically designed for postpartum depression, and probably works in ways much different than standard antidepressants. It is a progesterone analog, so it's not an SSRI or other antidepressant like the other meds are. And it works much faster. So it's an IV infusion that takes something like 2 or 3 days, 60 hours, I think it was. You have to do it in the hospital because there are occasional people who have enough dizziness and lightheadedness that they actually kind of need to be monitored. So apparently that was one of the main side effects. The medication was like passing out. So not a big deal if you pass out in the hospital, people will keep an eye on you, but it might be a big deal at home. So that is the only limitation so far. It's extremely expensive is the other potential limitation. I'm sure that it will require some pre-authorization through insurance, possibly documentation that other medications weren't working or that the symptoms are very severe, things like that. But it is out there. If you guys have interest, give us a call at the office. We can talk more about it. It's just been approved. I don't know if either of the hospitals are up and running with doing the infusions yet, but that's out there. Okay, so we've got some questions popping up on both Facebook and YouTube. So let's see. On Facebook, we've got, are probiotics safe during pregnancy? Yeah, probiotics are fine. No harm at all. And let's see. I'm just going to move this up so I can see. Whoa, a little better. That's worse. Sorry, let me just shuffle these around real quick. There we go. Do you have to have, is the mini pill the only pill a breastfeeding mom can take? No. So really any of the birth control pills are fine. The sort of modern day low dose birth control pills for the average person who has a good milk supply really shouldn't affect things much, if at all. So I tell everybody the same thing, keep an eye on it. If you feel like it made a difference in terms of reducing breast milk, then of course stop it. But the average person does just fine. So really I counsel people they can try about anything they want, and generally it's not a big deal. Let's see. How long after having an IUD removed would it take for hormones to level out? It really is immediately reversed. So I just saw a patient yesterday who got pregnant within like 2 weeks of having her IUD removed. So it's immediate. There's no need to wait. Okay, got lots of questions popping up here on YouTube, so let me try to get caught up. Let's see. Just had Tdap yesterday at 34 weeks, having muscle aches, nausea, low-grade fever. It could be a little vaccine reaction. I wouldn't be concerned unless you have very high fever, 101 or higher, feeling really sick or something like that. But a little low-grade temperature elevation, a little muscle tenderness, probably no big deal. So I would just keep an eye on that. If something got worse, I'd contact your doctor. Let's see, if clomid and the scan show you've ovulated, but 3 cycles, no pregnancy, what do you suggest next? If someone's done clomid for a few cycles and isn't getting pregnant, the general question is now what? And so my advice is check the sperm and check the tube. So hysterosalpingogram, HSG, we were just talking about a minute ago, and then also a semen analysis. And if they're both normal, then you might consider switching over to Femera, which is letrozole. And for some people that works better. Let's see. Got another one here. Husband's taking HCG, levels are going up. Is there a good chance I'll no longer shoot planks? HCG in a man could potentially reduce sperm count. I am not a urologist, and I'm not going to claim to be a men's health expert, but I think HCG can actually reduce sperm count. So I would check with their doctor to see about that, but that's not one that I'm going to claim to really be an expert on. Let's see, can fibroids cause cramps? Yes. Doesn't think it's endo, large fibroid. Yeah, and there may even be some benefit to taking Orilissa with fibroids. We just don't know yet because it's a new drug and it was approved specifically for endometriosis, but it may help with fibroids as well. And there probably will be studies that are coming out that look at that. Let's see. Moving to Utah County anytime soon. Haven't lived anywhere. Nope, you can come on up here to Ogden though. Let's see. Shelby, how likely is to get pregnant when you're not ovulating? Not very. Never really kept track. Got pregnant. Never really struggled. Hasn't been luck chance. I've been ovulating at that time. It sounds like you've been ovulating. I mean, you got pregnant every time, Shelby. So, I mean, the thing that I tell people to look at is, regular periods and some signs of ovulation, whether that's some mid-cycle cramping or changes in cervical mucus, and then some sort of premenstrual symptoms, breast tenderness, moodiness, bloating, whatever, that resolves when the period starts. And if you have regular cycles plus some of those symptoms, then pretty good chance you're ovulating. If you're not, you might want to look at ovulation testing to see, or come in for ultrasound, that kind of stuff. So nauseous last time, ovulation. Could be. Yeah, I mean, it could be nausea associated. I mean, it could be pregnancy too, so... hang on just a second. I'm getting a text here. I'm just make sure it's hitting something. I can't wait. Hang tight 1 second. Getting text from another doctor in town. Okay. Sorry about that. All right, let's see. Let's see here. Want to know if clomid would work, would Femera work? I've stopped all medications. I'm not really... If clomid didn't work, would Femera work? It might. Yeah. So some people do better on Femera versus clomid. So I'm pretty quick to, say do 2 or 3 cycles. And then if you're not ovulating on clomid, switch over to Femera for sure. So it's certainly reasonable to think about switching over. Laura Bell is pregnant. Holy moly. Congratulations. That's awesome. Who's the lucky guy? Let's see. What are complications that could happen with hypertension during pregnancy? So it's mostly preeclampsia, essentially, is the number one thing, and then all the things that can come as a downstream effect of preeclampsia. So I'm just going to refresh this feed because it's acting weird. So, severe preeclampsia, abruption, growth restriction of fetus, lots of things that can happen. That chronic hypertension is a risk factor for preeclampsia and then leads to complications from that. So that's the main one. Growth restriction in a otherwise uncomplicated chronic hypertension can happen. It's not as common, but it does happen. And so that's kind of stuff to watch for. Interestingly, if you have chronic hypertension, there is evidence that taking a low dose of aspirin every day could reduce your risk of preeclampsia. There's a video on my YouTube channel about that. So if that's you, then you might want to check that out. Obviously, everybody over here on YouTube knows my channel, but if you're on our Facebook, you might not. So I'm just going to type it in. If you just pop in Wes D Ski onto YouTube, you'll find my channel. And there's a video on there talking about preeclampsia prevention. So I'll just put it in the Facebook feed there. Okay, let's see. Chris, when your baby's breech, do you try to flip them? Yes. So external cephalic version is the name of that procedure. And I just did one the other day that worked. I did one last week that worked. So there's at least a 50-50 chance that it'll be successful in my experience. And that's certainly preferable to a C-section. So I definitely would recommend that to somebody, generally around 37 weeks. So we wait till about 36 to see if they're going to turn on their own or not. And then if they don't, then we would talk about getting them turned. Okay, let's see. What's the role of aspirin? That's what we were just talking about. So there's studies that show that reduces the risk. It's not entirely clear why, but there's good evidence that about 81 to 120 milligrams a day of aspirin starting at about 12 or 13 weeks and taking it for the remainder of the pregnancy could reduce your risk. So that's what we recommend. All right, let's see. Camille says, is early labor something to worry about when you have kidney stones? Not really. I've seen a ton of patients with kidney stones throughout my career, and I honestly can't think of one who went into labor. So I think the trick is more about trying to figure out if the pain they're having is preterm labor or their kidney stones. I think that can be hard to sort out sometimes. But I've never seen anybody go into labor who had kidney stones, so I wouldn't worry too much about that. The main thing I tell people is, if it feels like it could be contractions, then get checked out. Okay, let's see. Kevy, are pregnant women more likely to get eaten alive by mosquitoes because of the extra? It might just be you. You might just be really tasty to mosquitoes. So I don't think there's anything else about that. Let's see. What's the difference between a chemical pregnancy and a miscarriage? Well, a chemical pregnancy, a pregnancy that's only detectable by hormone levels, that's that beta HCG, may or may not lead to a miscarriage. So, if those levels are going up, especially if they're doubling, then it might just be very early. One where those levels then start to fall would be a miscarriage, and in that case, someone might call that a chemical pregnancy. So I think that's just a little bit of semantics that you're getting caught up on. So it's really all about that HCG trend, and if the levels are going up, we're in good shape, and if they're going down, then of course that's concerning for miscarriage. Michaela says, just did first round of clomid, didn't ovulate till day 22, would increase dose be beneficial? Increasing dose might be beneficial. Hi from New Zealand, by the way. Holy cow, you win the award for the furthest away from this YouTube broadcast. That's amazing. We've been to New Zealand. We were on the North Island. It was beautiful. We started in Auckland and then went down on the Comoral Peninsula, which was absolutely beautiful. And then some other places I can't pronounce, and then wound up hanging out with some Maori people. That was super cool. They're the most amazing people. But anyway, to answer your question, increasing the dose of clomid could be beneficial. Check out my video on the channel there talking about how to take clomid or Femera. You might want to think about doing ultrasound for a follicle check to see if your body's responding. And if there is a good looking follicle there, then sometimes doing a trigger shot could help. That's something to consider. So I talk about that in detail in that clomid video, so check it out. Laura said, doctor told me to take a baby aspirin because of that MTHFR. Yeah, it's fine. It's not going to hurt anything. The MTHFR mutation really is not associated with increased risk of blood clots like some of the others are. It's not entirely clear if that even means anything at all, but it's certainly not going to hurt anything to take a low dose of aspirin. So I think that's fine, but I really wouldn't worry about it. Let's see. I like this name, Lemongrass 11. Your baby's head down. That's good. How do I know looking up or down? There's nothing you can do to control it. And it doesn't really matter until you're in labor. And even in labor, it'll often change as the head kind of descends into the pelvis. So nothing you should worry about. Most of them work it out just fine. And there's nothing you can do to change it anyway. So don't stress. Let's see. Okay. Amanda, clomid or Femera? They're both good. So I usually start with clomid, and if the patient doesn't ovulate, move on to Femera. So there's a video on my YouTube channel. I was just talking about that a second ago that talks about how I dose it, how I monitor to see if it's working. So if you haven't checked that out yet, go check that out on my YouTube channel. Okay, Ashbow Jenkins, another great name. Is it normal to have round ligament pains 6 weeks? That's a little early. 35, 7th pregnancy. Yeah, I mean, that's the only other thing is like you've had several babies. And I do make this observation that it seems like the more kids you have, the worse it gets. And you do seem to feel things earlier, although 6 weeks is really early. So if you haven't been seen yet and you're having some pain, it'd probably be a good idea to be seen, have an ultrasound. Just make sure the baby's in the uterus, make sure everything looks okay. Make sure there's not like some big giant ovarian cyst or something that's causing your pain. And I think once you check those things out, then you can feel, pretty reassured that everything's fine. But I do make that joke with people that the first baby, nothing hurt at all. Second baby, start having some pain towards the end. Third baby, it's like halfway in, you're dying. By your sixth baby, you miss your period and everything hurts. So maybe it's actually true. Let's see. Esmeralda just mentioned took some letrozole, made her feel like she got overweight. Yeah, I mean, you may have a little fluid retention for a few days, but it wouldn't lead to weight gain per se. Let's see. Ariel says, heard removing the tubes can be bad in terms of making periods worse. However, is this true? Yeah. Well, so the short answer is probably not, but we don't know for certain. It's not well studied is one good answer. There was one study done years ago that didn't really seem to prove that there was an association between tubal ligation. Back then, we weren't removing tubes. We were just clipping them or burning them or whatever, and subsequent changes in your menstrual cycle beyond what you might expect from someone who stopped taking some other method of birth control. So if you were on birth control pills and your periods were great, and then you stopped them because you got your tubes tied, well, maybe your periods are worse just because you stopped your birth control, and that may still be true. It's not clear if there's anything beyond that. So it's not something that I think is a big problem. There's so many factors. I mean, your periods typically get worse as you get older anyway. They tend to get worse after you have more kids. There could be other things going on, fibroids and things of that nature. So I would recommend, if you're having problems, maybe just getting checked out, kind of go from there. Janica says, what do you personally don't like about McCady versus Log? I like them both. I go to both every day. They both have nice rooms. They both have good nurses. They both have good NICUs. They both have good anesthesia. So I always just tell people, whichever one your insurance goes to is the one you should go to because they're both good. So you can't go wrong. All right, let's see. Christy, not have any more kids. I must have missed your first question. Let me see. I think I missed it. Christy, I don't know if I saw your first question because I just see your by the way comment. Not have any more kids, by the way. Oh, there it is. Do you need to come in for a yearly, even though the PAP is every 3 years? I'm right at 2 years. Yeah, probably not a big deal. I mean, that definitely has changed recently. So we're doing pap smears less frequently. If you're in your 20s and they're normal, we're going 3 years. And if you're in your 30s and up and they're normal and your HPV test is negative, then we're going 5 years. So if you're not, you don't need a birth control pill refilled, you're not having any other problem, do you have to come in every year? No. I think every 2-3 years is certainly very reasonable. There's not great evidence-based guidelines to tell us that based on this study, this is how frequently you should be seen. We just always did it every year. So I think you're safe where you are. If you're having any problems, we should see you, but otherwise maybe just come in at that 3-year mark for your next PAP. And now the not having kids anymore statement makes sense. Okay. Londi, let's see. You might not know the answer. That's fine. Just diagnosed with gray matter, heterotopia. Neurologist said developing the wound. What are the chances of having current pregnancy? Not very high. And is it something they can detect before birth? No. And what exactly causes it? We don't know. So see, I did know the answers. Not to make light of it, but it's, these neurodevelopmental stuff is extremely complicated and poorly understood, but probably random and probably not something that's going to happen again unless it is known to be associated with some particular genetic mutation. So if the doctor is taking care of your baby, say that as far as they know, there's no known genetic association, then I would not be concerned about that kind of thing recurring again in the future. Hopefully that answers your question. Thanks. Okay. Let's see. As far as being CNA and having lift residence, what's the weight limit? 10 weeks Thursday, blah, blah, blah. Yeah. So generally, if you're just like helping a person move from A to B, I think that's fine. What we know is that sort of like industrial lifting, so you work on an assembly line and you're moving 25, 30 pounds every 20 seconds or a minute or whatever all day long, that there is some association with growth restriction, preterm birth, things of that nature. So we don't recommend repetitive heavy lifting like that. And I think for someone, we have tons of people who are CNAs and nurses and, all that, MAs, who are helping move patients and all that all the time. And I think as long as the pregnancy seems to be going okay, then, and as long as you're able to tolerate it, not having a bunch of pain or whatever, then it's fine. And certainly at 10 weeks, it's fine. I wouldn't worry about it until, much later in the pregnancy. Okay. Hey, Bethany, how's it going? Let's see. Had a fibroid removed last August. It's grown back, same spot. Might get another surgery. Will that affect your ability? Had it removed vaginally. I'm assuming that means it was like an intracavitary fibroid. So they went up inside your uterus with a hysteroscope and removed that fibroid and it's grown back. That's pretty common. They're actually pretty difficult to completely remove that way. And you want to be conservative and not injure the uterus. You don't want to poke through the uterus and cause damage outside the uterus. So it's pretty hard to get all that fibroid out, and they can grow back. I would recommend, if you're thinking about getting pregnant, getting it checked before you did, because if it's grown back, you should get it treated, because it could be associated with higher risk of miscarriage, for example. Let's see, lemongrass, do more moms go in labor at night? I don't know, it kind of happens all the time. So, we tend to remember the ones that are in the middle of the night because they wake you up, but I think they happen all the time. Let's see, Amanda, would you be concerned with AMH 0.75 at 37? So the main thing to tell you, Amanda, and there's a video on my YouTube channel about this, is that AMH level, anti-Mullerian hormone level, doesn't predict spontaneous, pregnancy. So that level is useful for predicting your chance of successful in vitro fertilization, but not getting pregnant on your own. So it means really nothing in this context. And we've all checked him. I checked him for years, but a study came out last year that showed that this thing just was not predictive. So I quit doing it. And it's discussed further in my video on the YouTube channel there. Let's see. Lonnie had a follow-up. Would Fragile X be associated? We don't know. That's the short answer, but it's possible. Christina, gaining weight like crazy. Don't think there's anything wrong with thyroid. Still nursing. Is there a chance you have PCOS? Something like metformin help? Metformin, might cause a little bit of weight loss because it tends to cause some gastrointestinal side effects, diarrhea, for example. And some people do lose a little bit of weight. And so, perhaps that's helpful. It's helpful if you have diabetes, of course. It may help some of the other symptoms of PCOS, like the acne and stuff like that, but it's not tremendously helpful unless you're truly diabetic. So I wouldn't get too locked in on that being the answer to everything. Let's see. Brittany, 7 weeks pregnant. Congratulations. Work special needs, pick up care, mostly teenager. Really careful. Yeah, like I was talking about a minute ago. Just you wouldn't want to do that like repetitively. And there's probably going to be a point in pregnancy where you're just not going to tolerate that kind of lifting, and you'll just have to not do it. But for now, it's fine. Okay, let's see. Genesis. If your karyotype came back clear, why can't you start your IVF till your husband's came back? Well, I'm assuming you had karyotypes done for recurrent miscarriage. And that could be associated with maternal chromosome abnormalities, and it could also be associated with paternal chromosome, dad. So you would want to do an in vitro cycle with dad if it turned out that he was a source of repetitive karyotypic abnormalities. So that's why they're recommended to wait. So I think that's probably good advice. Okay, Laren, when would you know the probability of a C-section? Yeah, it's not something you can predict prospectively. So, that's oftentimes a game time decision. We can talk about it more in your appointment tomorrow to see what specific things are going on there, but it's not something that we just arbitrarily schedule. Now, if you've had a prior C-section and you've had one prior low transverse C-section, then I encourage people to at least look at what are their chances of successfully having a vaginal birth. And there's a video on my YouTube channel that talks about that in detail. There's a link in there you can go to that you can actually calculate your own chances of success. It has to do with things like your height and weight, your ethnicity, and the reason for this C-section, things like that. And if you plug in all the details and hit calculate, it'll give you an answer. And if you get over 60% or higher, then I encourage people to consider trying for a vaginal birth if you've had one prior C-section, and maybe even if you've had two. So hopefully that answers your question. We'll talk about it more, I guess, at your visit. Let's see. Allison, can you get an IUD after C-section? Yes. Totally fine. There you go. That was easy. I like those yes, no questions. Cool. All right. I'm all caught up. All right. Hey, Dee Dee, how's it going? Haven't seen you in forever. Let's see. How far along do you have to be for your first ultrasound and actually see the baby? Well, to see a baby well, at least 6 weeks, 6 or 7. As early as 5 weeks, you can see a little yolk sac, and that's the first sign of an embryo actually in the uterus. But if you want to see a baby in a heartbeat, you got to be at least 6, and and that's with a vaginal ultrasound. And it's easier to see it, like, say, at 7 or 8. But 6 is kind of the minimum. Let's see. When does the period start after breastfeeding? Well, it might not start until you stop nursing, and especially if you're exclusively nursing, because that'll create a fair amount of prolactin, and prolactin suppresses your period because it suppresses ovulation. Let's see. Genesis said, husband's karyotype, if it comes back abnormal, can you not use a sperm? Yeah, potentially. It depends on what the situation is. There is still a possibility, but it would depend on what they found, and so that's a little hard to answer sort of in general. But there's a possibility you still could, but you may need to do what we call pre-implantation genetic testing, where they actually test the chromosomes of the embryo before they do the transfer of the embryo. Okay. Well, I'm glad you're doing well, Dee Dee. Chasing around a 1-year-old. Dee Dee said her period came back after 11 months without a period while breastfeeding. Okay, Carrie, 16 weeks. What can you do for mid-back pain? Mostly, so there is a handout at the office I give people that talks about just some stretches. It's essentially kind of core yoga sort of stuff to try to get those vertebrae moving and back into alignment, strengthen the muscles around them. So a fair amount of it is just pregnancy related, but some of that kind of stuff can help. I'm sure if you do some Googling, you can find similar type exercises online. Let's see. Can you also talk about molar, partial molar, proper follow-up? No one talks about it. That's interesting. That's kind of a long topic. Maybe it'd be a good video idea. But essentially, molar pregnancies are abnormal conceptions that are typically where 2 sperm fertilize 1 egg, or a sperm gets into an egg and then the chromosome material splits, duplicates. It's really weird, but you get these duplications of paternal chromosomes in the embryo, and that just isn't compatible with life. They usually make this just lumpy grape-like looking material that if you look on an ultrasound kind of looks like a snowstorm. The treatment is to evacuate the uterus with the DNC, and the most important thing to do is to follow your levels, because they usually will resolve with surgical evacuation of the uterus, but they can act like a cancer. They can spread, and so it's really important to follow those hormone levels and be sure that it does resolve. And it can take months, and the typical follow-up is at least 6 months to ensure that all that stuff resolves. And we recommend folks getting on birth control during that time so they don't get pregnant, because it's all confusing, like, well, are your levels going up because you're pregnant, or are your levels going up because now you have post-trophoblastic neoplasia, gestational trophoblastic neoplasia it's called. So that is a big deal. It's a big topic. Hopefully that kind of gives you some feel for it. Genesis, is it possible after 2 C-sections VBAC? Yep. And there's a video on my YouTube channel about that. And thanks for the lives. You're welcome. I like doing these. They're fun too. Let's see. Can you do a video on postpartum hypothyroidism? Yeah, it's a good one. That's a big topic. I'll add it to the list. If other people have other requests, let me know, because I've run out of ideas for videos. Postpartum, the pen doesn't even work. Let's see. Postpartum hypothyroidism. Got it. Okay. Can you explain the difference between the 2 protocols for IVF? Not really. So I'm not a reproductive endocrinologist. I don't do IVF. I mean, I know about it in general, but I'm not going to claim to be a specialist or expert on that topic. And I'm not even sure what you mean by 2 protocols. So sorry, I can't answer that. I mean, if you have some more information, I can maybe talk about it, but I don't really know the 2 protocols for IVF. Okay. And then someone asked, can you have vaginal birth after 2 C-sections on Facebook? Yep, I already said yep to that. There's a video on my YouTube channel about that. So if you haven't seen it, go check it out. Mikhail, hello. Do you find that things like Masca root or other supplements help with fertility? No. There's really no evidence of any supplement that's useful in terms of helping you get pregnant. The main problem with just sort of supplements in general, in the U.S. at least, is that they are not regulated by the FDA. We do not have good studies that are done in a controlled manner to tell us if these kind of things are beneficial or not, if there's harm or not. So the short answer is we don't know. There's no proof. I don't recommend them. Let's see. Tiffany, do all the providers do infertility visits like follicle checks, Femera? Yes. Had your last baby with Housel, got pregnant with Ari? Yeah. Yep, so we do all that stuff. We don't do injectable like FSH. So we do HCG, which is another, Go-Now is another name for that. But if you need more than, say, Femera or clomid, an injectable for HCG, and we do inseminations. But if you need anything more than that, then that's when you need to go to reproductive endocrinologist. Let's see. Chandel, thoughts on preventative hysterectomy? Mom had uterine, ovarian, cervical, bunch of uterine cancer. The first thought that I have is you ought to see a genetic counselor and have testing, because there definitely are cancer syndromes that are known to be associated with certain genetic mutations. And a genetic counselor is best suited to sort of suss those out based on your family history and recommend what tests you ought to do. One that comes to mind is called Lynch syndrome. It's associated with uterine cancer and colon cancer primarily. And I have had a patient that we did do like I said, preventative hysterectomy. She'd already had colon cancer. And so she had a hysterectomy after she was done having babies. So yeah, it does happen. So Didi says she swears by Fertility for men. I don't know. Not sure what that one is, but I'm glad it worked for you. Let's see. How risky is it to breastfeed being 7 weeks pregnant? Not a big deal. the main thing is that you may start to see some reduced breast milk supply as your estrogen and progesterone levels go up while you're pregnant. And if you got pregnant, that indicates to me that your prolactin levels were already declining, because if you're breastfeeding exclusively and you're having no periods, and you still have a high prolactin level, you wouldn't ovulate. So probably your breast milk supply was already on the way down, and this might push it a little further down. So just to be aware of that, but it's not dangerous by any means. Okay, so I think I'm all caught up. If you hear that hiss, that's our dog messing with the cat. Oh, it's really sweet. She's over there licking his forehead. Okay. Well, you guys, I think I'm all caught up. So let's see if I missed anybody's questions. If you weren't on here when I started, I was talking about there is a new medication for postpartum depression. Brexanolone is the generic name. It's an injection. It's an IV infusion. It takes like 3 days, and it's new in the sense that it's not like any other antidepressant out there. It works in a different way. It's a progesterone analog, and it's specifically for moms with postpartum depression. You have to do it you have to be hospitalized to do it, because some of the side effects, primarily like passing out and stuff like that, apparently. But it appears to be like amazing. Like immediately you get better, which is crazy great. So I'll make a video about that. I've got it more or less ready to record. I just haven't done it yet. But in case you guys were interested, that's out there. You can probably read a little bit online about it by now. It just got approved by the FDA a couple weeks ago. And it's called Brexanolone, I think. Okay, well, let's see. We've been going for, about 40 minutes. I'm not seeing any other questions pop up, so if you guys have a question, put them in the chat. And otherwise, probably we'll wrap it up, because I'm not seeing too much. Oh, here's one. What are your thoughts on effectiveness of perineal massage to minimize risk of tearing? There's not good evidence on it. It's been studied, and it didn't really seem to make a difference. So I don't think there's anything wrong with it, but it's not been proven to be of any particular benefit. Let's see. Does Zoloft help postpartum depression if you're already on it? Yeah, and sometimes, we just increase the dose. So say you're, on 50 milligrams or whatever, and then after the fact things are getting worse, then we might just increase the dose. So Lonnie's saying, yes, please. You have postpartum depression bad with your chest. I'm assuming you mean with your first, and worried how bad it'll be with your second. Yeah, first. There it is. Yeah. It's a thing, no question. And if you have a history of depression in your first, the risk is higher for a second. So it's something to definitely be aware of and watch out for. So stay tuned as far as the info goes on that new medication I was telling you about. Let's see. Is it normal to have pain during cycles after hysteroscopy? Not necessarily. And how does obesity affect fertility? There is some association with decreased fecundability, which is a fancy way of saying your ability to get pregnant. It could be for any number of reasons why that is. Maybe the link is PCOS and insulin resistance and things like that. There may be other factors we're just not aware of. There are some associations with obesity and inflammation, and that could also have some effects as well. Let's see. Randomly Remy, I like that. If you failed IUIs and you have PCOS, do you think metformin will help you get pregnant, or should you do IVF? Well, you didn't say if you've used clomid or Femera, letrozole, clomiphene. If you've used clomid or Femera and you haven't gotten pregnant, it's not wrong to throw in metformin just for good measure. And if you're still not getting pregnant, then you probably need to do injectable fertility drugs. You may not necessarily have to go all the way to IVF, but at least injectables maybe. Let's see, Michaela. First pregnancy, stillbirth, a week after iron infusion. Fetal maternal hemorrhage. Is there a link? No, I don't think it's anything to do with that. It's a scary situation that you had, and it's terrible. I'm really sorry, but the iron infusion has nothing to do with it. So now, maybe if you were having kind of chronic bleeding from chronic abruption or something that was causing your anemia, then the link that might be the link is the anemia, but not so much the iron infusion. So I wouldn't think that one has anything to do with it. Oh, good. Well, I'm glad Ashbo just mentioned she watched my advanced maternal age video, and that helped her decide to try for just one more. So did you get pregnant? Are you pregnant now? Did you have a baby? Let's see. I think I'm caught up. Oh, someone had to do a video explaining in depth about fibroids. Yeah, I haven't done fibroids. I'll put it on the list. I'll talk about it briefly since nobody else has a question right now. So fibroids are benign, smooth muscle growths that just randomly pop up in the uterus. They're benign. Typically, they're not cancer. Maybe 1 in 1,000 or something less than that is actually cancerous. Oh, congrats, Ashbo said. Yep, 6 weeks. Got pregnant. Good for you. So yeah, fibroids are these benign, smooth muscle growths that just kind of pop up in the uterus for whatever reason. And they can be sort of small, even in the, less than the size of a grape. And they can grow even bigger. Even like I've seen some the size of a grapefruit. Some people have 1, some people have 31. It's just random how many you might have. They're more common in African American women, but they certainly happen in all ethnic groups, and it's not clear why they'd be more common in African American women, but that appears to be the case. I think it's something like up to half of African American women have at least one fibroid, and I think it's more in the 15 to 20% in Caucasian women, but certainly it can happen to anybody. And they can be located in several parts of the uterus. They can be just in the muscle of the uterus, in which case they're called intramural. They could be in the cavity of the uterus. We call those intracavitary. The intracavitary ones are the worst ones. They tend to cause the worst problems with bleeding and miscarriage and things like that. So that's kind of a quickie version. Surgery is one of the most common treatments. It sort of depends on where it's located as to how you might approach that surgically. Talk about polyps. Yeah, same concept. So polyps are kind of like fibroids. They're just these random little growths that arise from the lining of the uterus, so the endometrium. They're almost always benign as well, and they are equally random, just like fibroids are. And the problem with polyps, we think, is if there's something in the cavity of the uterus that's not supposed to be there, that interferes with implantation. And it's probably not just because it's, that particular spot is taken up by the fibroid or the polyp. There's probably more to it than that we don't understand. Because the uterine cavity is pretty big, and if you had one little polyp, that's not that big of a deal. So there may be other things going on there. Maybe it's sort of a inflammatory response, sort of a foreign body type reaction. That's how IUDs work, actually, is you stick a foreign body in the uterus like an IUD, and it causes a sterile foreign body sort of immune response. And so that essentially becomes like spermicide. So then the sperm wander in there and get annihilated by all this inflammation. And that might also be true of polyps in terms of how they interfere with things as well. But the good news is they're easy to treat. So, we can put a hysteroscope up inside the uterus. You can see the polyp, and you just take it out with a little cutting device. It's really quite simple. So I'll add that to the fibroids. Fibroids and polyps. We'll do that all as one video maybe. Okay. Randomly Remy says, when should you be concerned with on and off bleeding having PCOS? Short answer is it depends. So it depends on if you're trying to get pregnant or not. When you're trying to get pregnant, it's an issue, of course, because you're probably not ovulating regularly. So that's an issue. And if you're not trying to get pregnant, then it's more just about like how bothersome is the bleeding. And then in people who are, say, over 35 having irregular bleeding with PCOS, a little bit of higher risk possibly for endometrial cancer. So anybody kind of 30, 35 and up, especially if you're overweight with PCOS and irregular bleeding, you ought to see a doctor and get that lining of the uterus checked out. You can do it with an ultrasound. And if it looks normal, don't worry about it. But if it's a little thickened, you probably ought to have a biopsy just to prove there's no precancerous or cancerous stuff going on. Let's see. Genesis has a question about how do I feel about multiple pregnancy when they want you to subtract one. So what you're talking about is called selective reduction. And how I feel is not particularly important, but what does the evidence say I think is more important. So if you look at triplets or quadruplets, there is evidence that selective reduction down to twins improves the outcomes for the remaining babies. That's an emotionally charged discussion that people have all kinds of personal feelings about, and I won't get into all that. But if you look at the evidence is there. And there's lots of studies out there that you can read that talk about that. But there is evidence that it's beneficial to the surviving, say, twins, for example. Let's see, Elise, what's the difference between endometriosis and fibroids? So endometriosis is what we call endometrial glands and stroma, so the tissue of the lining of the uterus, identified outside the uterus, so like within your pelvis. And a fibroid is just a smooth muscle tumor or growth from the uterus. So those are the big differences. Fibroids mostly cause heavy periods, maybe cause some pelvic pain just by virtue of being there, just their physical presence, pressing on other stuff maybe. Endometriosis probably causes pain more through inflammation in the pelvis. So they're often treated similar ways, like you could put either a person on a birth control pill and probably help with their pain or a heavy bleeding, for example, with fibroids. Hope that answers your question. That's kind of a big picture answer. Let's see. Had an IUD to stop your bleeding after fibroid removal, but then it grew back, started to push the IUD out, you're on the pill, still bleeding. Yeah, it maybe that fibroid's growing back, so hard to know without, getting into it, maybe doing an ultrasound, that kind of thing, but that sounds like that might be your problem. Can you express colostrum before birth? Yeah, I don't know that there's anything in it at that point. It sort of depends on how close you were to delivery. The constitution or the things that are in breast milk change day by day, even after delivery. So what little bit you might be able to get out of before you even had a baby is probably not particularly useful. So I wouldn't worry too much about that. Genesis, is it safe? We're talking about selective reduction a minute ago. There's some risk that you lose all the pregnancies, but that's in that analysis I was telling you about. So that's kind of factored into the discussion that in the big picture, outcomes are best after the reduction. Let's see, Carrie, what do you recommend for pregnant patients who experience anxiety about losing a baby when they've previously had miscarriages? Yeah, I mean, there's no easy answer. I'm not a psychiatrist or a good life coach or anything, but my best advice is kind of stay in the moment and do things that help you reduce stress. And everybody's different on that. Easier said than done, I know. Let's see. What are your thoughts on the Honor Detox Pearls for cleaning the vagina? I don't recommend sticking anything in the vagina to clean. There's no evidence that anything that you'd put up in there is going to make anything better than it already was. So I don't recommend that. Hey, Island Girls from Italy. How's it going? We had somebody here a little while ago from New Zealand. So New Zealand is now the furthest away I've ever talked to somebody on YouTube or Facebook, which is pretty crazy. But Italy's still pretty good. Let's see. Fitting an IUD for women who've not had a baby yet, is it painful? It can be, but there's this IUD called Skyla that is smaller, and it's a lot smaller. And it was designed for people who've not had kids yet. So it's a lot easier to put in. It lasts for 3 years. And there is a new one called Kylena, which I think is similar size. I haven't really held them up beside each other, but I think they're similar size. And that one's good for 5 years. But Skyla for sure. I've like held some of those in my hand after removing them. They are tiny. And they're pretty easy to insert. So I don't think I've had a patient yet who hasn't had kids where I tried to put a Skyla in that I couldn't get it in. And most of the time they go really easily. So I think it's a good one to consider. It's Skyla. I'll type it in the chat here. Well, I guess there, create a channel. I don't know how. Skyla, Skyla. I can't get it. Well, let me type on my own live stream. I don't know what that's about. That's weird. Okay. Heather asks, what's the recovery time for a Novasure? A couple days. The day of, you're really crampy, and the next day you're probably still kind of crampy, and by the day after that, you're typically fine. Sheena, getting a C-section tomorrow. Well, good luck. 37 weeks, hypertension, blah, blah, blah. Doc doesn't want to cut from is all it says. Not sure if there's more to that than same C-section. Doc doesn't want to cut from same C-section scar. Is that normal? I mean, if I'm going to do a repeat C-section, I cut through the same scar, so I'm not sure what the concern is there. Or maybe I'm not understanding your question. And Birkenbag says she's in the UK. Man, that's awesome. We got some international representation going on. It's pretty cool. All right. So Sheena, let me know if that was answering your question. I'm not entirely sure that I got it, but from what it sounds like, I mean, like I said, if I do a repeat C-section, I'm just going to go through the same scar, because why would you give somebody 2 scars? I don't know. There's no reason not to. Okay. I'm all caught up again. So we'll give us a couple more minutes. There's some other people I noticed have jumped on. So if you have questions, throw them in the chat. We'll probably go for another 5 or so minutes, and then we'll call it a day. Nobody's jumping on. There's a, I will give you, I haven't read this book yet, but I'm gonna. I'm just gonna find her name. The author's name is Jennifer Gunter. She's pretty awesome. She's a pretty kick-butt OBGYN from Canada. And she's very strong opinions, but she's very smart and knows what she's talking about. And she's got a new book that's called The Vagina Bible. It's coming out in August, apparently. So I'm looking forward to reading that. It says this book is basically everything you ever wanted to know about the vagina but were afraid to ask. The Vagina Bible. I'm going to check it out. Let's see. Where are you located? Love. So I'm in Ogden, Utah. If you, I think there's a link on my YouTube page there to our office website, but it's called Circle of Life Women's Center. It's in Ogden, Utah. Brittany, can you touch on birth control for smokers after age of 35? Yeah. So basically, the concern is that you have a higher risk of strokes if you're a smoker over 35, that you then get placed on birth control pills. It's probably the estrogen, so we don't recommend that. Now, if you quit smoking, it's fine. So there's your answer. Quit smoking, and you can take your birth control. Let's see. Mitchell and Serena. Diagnosed with ICP, which, if you don't know, intrahepatic cholestasis of pregnancy, based on 1 high bile acid. Since then, they've been below the cutoff. Would you still do it? It's a great question. Depends on what was the number. If it was 10, I wouldn't worry about it. If it was 100, I would go with it. And also, if your levels went down, they went down because you were on cholestyramine or one of those other bile sequestering agents, or was it just barely over the cutoff one time, no meds, and they've been normal ever since? I'd be less worried about that one. Island girl, 2 cycles of clomid, nothing yet. Well, fingers crossed. Just keep on trying, girl. Let's see. Is it true that you ovulate later, that the later you ovulate, the egg isn't as good? Possibly. So egg quality definitely can mess with your cycles. No question. Do you recommend injectables for infertility? Keep prescribing Follistim. Every IUI has failed. Do you recommend any injectables? Well, Follistim is an injectable, I think. Pretty sure. At least it is here in the U.S. So if you're not getting pregnant on injectables plus IUI, you might think about in vitro as the next step, maybe. Dee Dee says, what's the NovaSure? Oh, Dee Dee, there's actually a video on my YouTube channel about it. Somewhere, it's deep in there, but it's in there somewhere. It's the endometrial ablation. So that is a technique we do in the office to burn the lining of the uterus to make your periods better, hopefully stop and go away forever, or at least a heck of a lot lighter than they used to be. It's kind of nice. So it's an office-based procedure, just takes a couple minutes. You're down for a day or two, and then you're fine. So yeah, there's a video that talks about it in more detail on my channel. Giselle, I'm back. Hey, Giselle, you're back too. Good to see you. Yeah, I've been taking a break. I've been super duper busy. Dee Dee says she disagree. Dee Dee will let you know. It's true that if you ovulate late, it might not be. I didn't say it was. I said it could be. Ashbo, sex toy safe. Yeah, I mean, you may see some bleeding, and this is true of just regular intercourse as well. Anything that sort of touches the cervix could cause some bleeding. Not that it's dangerous, but it certainly could be nerve-wracking. So just be aware of that. Let's see. Haley, when should you start to be concerned if 20 weeks pregnant, haven't felt baby move yet? It all depends on your placenta. I mean, generally speaking, some people might not feel movement until 20 weeks. Most people are by then. If you never have, and if the baby's checked out okay previously, you're probably fine. But if that's not the case, then maybe get checked out. Let's see. We're talking about those bile acid numbers. It was 16, and their cutoff was 14.5, back down to 11 and 12 without meds. Yeah, I mean, it's kind of borderline. That's a tough call. Not wrong to call it. I mean, it was above the cutoff, but barely. How long after your period do you usually ovulate? Well, if you have a 28-day cycle, you ought to ovulate about 14 days later. But essentially, you could say, roughly 14 days before the start of your period is when you ovulated, roughly. Let's see. Is stem cell surge worth the money for baby? No. There's a video on my channel that talks about that in detail. For the average person, it's not worth the money. The studies would say that the likelihood that you will use this unit of stored stem cells is somewhere in the neighborhood of 1 in 2,000 to 1 in 20,000. It's a pretty low number, and it ain't cheap. But if you can give that cord blood to a public bank, then lots of people could benefit from it. And as long as it doesn't cost you any money, that makes perfect sense. So I definitely encourage public banking, but I don't recommend private banking for the average person. Now, an exception would be if you have a kid already who has leukemia and is going to need a bone marrow transplant, and now you're going to have another kid. Well, those stem cells from the second baby might help your first kid, but they're not going to help the kid themselves. And that's because the genetic mutations that lead to leukemia, for example, that led to that child having leukemia in the first place are in the stem cells also. So that's why you can't use your own stem cells to treat leukemia generally. It'll just give you leukemia again. So, but you can use a donor. So if you have a match from a sibling, that's great. And so that's where it could be useful. If you have a baby that's a child who's affected with sickle cell, same concept. You might use a sibling's stem cells for that as well. But for the average person, it's not worth the money. Yeah, cool. We'll see. What's your advice for someone who struggles with PCOS and wants to get pregnant? There's a whole video on my YouTube channel about that, Lauren. So I would go check it out. Essentially, some simple things include trying to lose some weight. There's evidence that 10 to 15% weight loss in some people will lead to spontaneous resumption of cycles. So that's one. Another is to correct any metabolic disorders that might be associated. So thyroid, for example. If you have diabetes, or getting tested to make sure you don't have diabetes, treating it if you do. And then potentially medications to induce ovulation like clomid or Femera. Let's see, Lori, how long after weaning a child can you expect your periods to return to normal? Yeah, it may take a month or two. So like a month or two after you completely wean, you should start to see regular periods. Now, some people get pregnant before then because they'll ovulate before they have a period, obviously. So I always tell people, be careful. So if you're weaning and you don't want to get pregnant, watch out. Okay. I think we're about caught up. We'll give us one more minute. We'll see if anyone else has a question. Then we'll wrap it up. Let's see. I think that's everything. I'll go back to this one that Dee Dee and I were talking back and forth about. Let me just reread the question. Is it true the later you ovulate, the egg isn't as good? I I think my answer to that would be more like egg quality can be an issue. It doesn't necessarily mean that your eggs aren't as good. So, and that I think that's what Didi was saying. So I think we can agree on that. Let's see. What do doctors do if your fluid is low and you can't seem to get it up? 18 weeks. Yeah, 18 weeks, depends on how low is low. So that's hard to answer in generic terms, but I can give you like extreme examples. So like if there's no fluid at 18 weeks, that's concerning because there should be some. And then you got to wonder about things like, does the baby have kidneys? Or are they functioning? Things like that. So then it's like, well, did they see the kidneys? How'd they look? If it looked okay and there's some fluid, then you're probably fine. The other question is, could you be leaking fluid? Because, of course, if your water breaks, your fluid is low. So we always think about that a little bit. But if that's not the case, then I'm less worried about that as well. And some people they just don't have as much fluid as others. So in and of itself, it's not necessarily a big concern. The biggest concern is if there's no fluid. That's the one you really got to worry about. Hopefully that answers your question. Most people are fine. It's kind of the gist of it. Didi said, did stem cell, a waste of a lot of money. It is. Tell people if you don't mind, how much did you pay? Because the ones around here in Utah, it's like $200 to $500 to process the initial specimen at the lab. The doctor might also have a fee for collecting it. And then there's some sort of yearly payment to continue to preserve that, to keep it frozen, basically, which is anywhere from a couple $100 and up. So, all in for the first year, you might be in over $1,000 or thereabouts. And it could be more depending on the lab that you're working with. So, yeah, I agree with Didi. It's a lot of money, and it is not worth it. Heidi was saying her fluid was just low and it was hard to see. Yeah, don't worry about that. You'll be all right. As long as they can see the kidneys, then, probably things are fine. Cool. All right. Let's see. Charlene, my sister got a light period for 2 days and still 4 weeks pregnant. Okay, good. Delayed cord clamping, is that beneficial? Yes. That is definitely beneficial. Oh, Birkenbeck says $1,500 for stem cell storage, or actually 1,500 pounds, which in the U.S. is like $1 million. I have no idea. It's a lot. Delayed cord clamping, is that beneficial? Yes, it is. And there's a video that talks about it in detail on my YouTube channel. So if you haven't seen it, check it out. But the gist of it is that you will see reduced neonatal anemia, so less anemia in the baby. If you let them have a little free transfusion from the placenta before you clamp and cut the cord. So that is basically standard of care, I think, in the U.S. now and perhaps in other places. The question is, how long is too long? And a minute is what most of the studies looked at. The concern is if you let it go on just kind of indefinitely, you might give them too much blood and then they have a higher risk of jaundice. So that's the only concern for like just leaving them on there indefinitely or until the cord stops pulsing or whatever. But a minute for sure is safe and beneficial, and that's generally what I would do. And there's definitely evidence that it's a good thing. All right. Nashville, Tennessee. Hey, that's cool. I used to live in Asheville, North Carolina, not too far from Nashville. So that's cool. My dad used to live in Chattanooga. So I spent a couple of summers there when I was younger. It's a pretty part of the country. Okay. Dee says yes. I forgot what I'm not sure what she's saying yes to, but it's a funny smiley face. All right, cool. All right, you guys. I don't see any other questions popping up. I think I've thought of everything. But Birkenbag said, yeah, 500 pounds storage annual fee. That's a lot of money per year. I mean, I don't know what the conversion rate is to dollars, but that's a lot. I mean, that's like probably $700 per year and $2,000 up front. So it's a lot of dough. Okay. Well, no other questions are popping up. I think this is a good place to call it good. Okay, we'll do one more. Sammy, 5 days postpartum, 2nd degree. Can you take a bath? Yes, you can. Go ahead, take a bath. How's the baby doing? Hopefully good. All right. Thanks to everybody. Appreciate your questions. Thanks for watching. It's been a minute. I'll try not to wait so long till next time. Good night, bedtime in UK. Sleep tight. See you later, Dee Dee. Sammy, I hope the baby's letting you get some sleep. You guys all have a good one. We'll see you next time. Oh, here you go. Is it normal to be recommended to get an MRI to look at the size of a fibroid? Yeah, it's okay. It's sometimes helpful. So there could be some benefit there. All right. We're out. See you guys next time.